This is the only health facility at Village 8 refugee camp near Sudan's border with Ethiopia. Dozens come here for medical assistance each day. TEKLU WOLDAY says he was warned by doctors back in his home country Ethiopia that he was developing cardiac problems. Now he says days of walking to flee from fighting in Ethiopia's Tigray region and standing in line for aid and for treatment is making him feel worse.
I was told to be careful, not to exhaust myself, to take care of my diet. But since I had to flee, my chest pains have been increasing, and when I come here, there's often a long line or no doctor.
For hundreds of patients in the camp that hosts more than 15,000, the center is the first and sometimes the only place to seek treatment. Despite that, it has little to offer to patients, all who fled to escape fighting from Tigray.
I wasn't suffering from anything when I was back at my cadre. I've been struggling to get medication since I got here, and the treatment is very poor.
More than 45,000 refugees have been displaced by the fighting in Tigray. It started 3 weeks ago following a government offensive on the Tigray People's Liberation Front. The offensive was a response to an attack by the front on a military base and came after months of tension between the regional government and the federal government. 2 camps have been opened in Sudan to cope with the influx of refugees. But providing services, especially health services, is challenging as more and more refugees continue to arrive. The camp here has 3 doctors who are also refugees to tend to the sick.
We don't have even a single microscope. We cannot do blood film for malaria. We don't have at least basic serologic tests that could be of some benefit. There are many cases with chronic diseases like diabetes and cardiac diseases, but we don't have the drugs. We don't have a single item of anti-diabetic drug, for instance.
Sudan's Commission of Refugees says it's trying to assist the refugees with access to health care, but needs support from organizations to be able to help the sick.
What's needed is for health organizations to provide emergency medications. The refugee community is now mingling with the local community, and some turn to local health facilities to get treatment. Health organizations need to step up to ensure that refugees have proper health care.
Most refugees here say they don't know how long they'll remain in this camp or if they will be relocated to places with better facilities. But they say they hope their calls for assistance will be listened to before a medical crisis occurs. Hiba Morgan, Al Jazeera, Al Fashaga, Gadarif State.